What if you had a perfect virtual copy of yourself? You know, a digital clone that could see illnesses coming years before you ever feel a thing. Well, this isn't science fiction anymore. It's the incredible reality of digital twins, a technology that's literally creating a virtual you to help safeguard your future health.
So let's just get right to the big question. Imagine this perfect virtual copy of your body, living inside a computer, running thousands of simulations on your health every single second. Could it actually predict a heart attack before it ever happens? That single question is the entire promise of the digital twin.
Let's make this real. Meet John. He's a busy dad in Lahore. Now, the data from his smartwatch and his diet logs all fed into a digital model of his body. And that model, it flagged a silent but very real risk for diabetes, and it linked it directly to his love for late-night biryani. That early warning from his virtual self gave him a chance to change his lifestyle and completely rewrite his health story.
So, what is a digital twin exactly? It's not just some static 3D model you look at. Oh no. Think of it as your body's living, breathing virtual clone. It's powered by a constant stream of your real-time data, meaning it's a dynamic copy that literally grows and changes right along with you.
You know, this idea actually has a pretty cool history. It all started way back in the 70s with NASA. They built virtual spacecraft to predict problems while the real ones were millions of miles away. Then the idea jumped to jet engines to prevent failures mid-flight. It was only in the last decade that we started applying this amazing concept to the most complex machine of all, the human body.
Okay, so how is a digital clone actually built? How do you create this virtual you? Let's dive into that. In part 1, we're going to break it all down. The whole process really boils down to 3 key steps. First, you need data. A lot of data. We'll call that the data deluge. Second, you use some pretty powerful AI to turn all that raw data into a predictive model. That's the AI alchemy. And third, you need a real-time sync to keep your twin constantly updated, literally second by second. So let's talk about step 1, the data deluge. We are talking about everything. Data from your Fitbit or Apple Watch, your entire electronic medical history, your unique genetic code from DNA sequencing, even lifestyle stuff from your diet apps or the air quality where you live. It's a massive amount of information. We're talking about a terabyte of data per person every single year. Now, the payoff for all that data collection, it's absolutely astounding. Once that model is built and validated against real-world medical tests, these digital twins can predict health outcomes with over 95% accuracy. Think about that. That is a staggering, almost unbelievable level of precision.
All right, so you've got a clone this accurate? How does that change the game for doctors and for us, the patients? Well, that brings us to part 2, medicine's new playbook.
This quote just nails the shift perfectly. Instead of that old one-size-fits-all approach, your doctor can now use your virtual twin as a digital guinea pig. They can simulate thousands of different drug combinations to find the perfect one, with the perfect dose specifically for you, all without you ever having to experience a single side effect. It's a total game changer.
The numbers here tell such a powerful story. I mean, look at this. Where traditional medicine might have a 70% failure rate for some treatments, the digital twin approach can boost the success rate to around 85%. And the time it takes to get it right, it drops from weeks or months down to just hours or days. The risk just plummets. This completely transforms the patient experience. But treating problems that already exist is really only half the story. The real revolution, the thing that gets me so excited, is in prediction. So let's get into part 3, forecasting your future health. The best way to think about your digital twin is as the ultimate weather forecast, but for your body. It analyzes all of your data streams to spot the early signs of a storm, a developing disease, long before you would ever feel a single symptom. And we're not just talking days, we're talking months, or in some cases, even years ahead of time. So what exactly can these twins predict? Well, they can identify heart blockages without you needing an invasive test. They can spot the risk of Alzheimer's disease a full decade early. In a hospital's ICU, they can predict the onset of sepsis 6 hours before it strikes. That's a critical window that absolutely saves lives. They can even forecast exactly how your body will respond to a new diet or a new fitness plan. And listen, this isn't just some far-off theory. This is happening right now. There's a company called HeartFlow that uses digital twins of our coronary arteries. In the old way of doing things, pretty much all patients with certain symptoms would need a risky, invasive procedure called an angiogram. With the HeartFlow twin, that number drops to just 39%. That means over 60% of people get to avoid a risky and expensive procedure. That's incredible.
The potential here is just immense. It really is. But this kind of powerful technology also brings up some really complex challenges. So for part 4, let's explore the road ahead and the critical questions we absolutely need to be asking.
We really have to look at both sides of this coin. On one side, you have this incredible promise of proactive wellness and truly personalized cures. But on the other, you have some very serious perils. Massive questions about our data privacy, the risk of bias being built into the algorithms, and of course, who even gets access to this revolutionary technology?
And this brings up some huge philosophical questions we all need to think about. Who owns the data that creates your virtual you? Is it your doctor? The tech company? Is it you? And what are the implications when this virtual model of you potentially knows more about your future health than you do? It's a lot to consider.
Look, the technology is here, and it's moving forward at an absolutely incredible pace. A virtual you is no longer a matter of if, but when. So the only real question left is, are you ready for your clone?